Wonderful. Okay. Well, thank you everyone so much for coming to see our presentation this morning. We will be presenting our innovation for the case study, Wellness Beyond the White Coats, Student Mental Health and Community Programming in New Brunswick. And we are group one, so being led by Ande, Tamim, Kyle, and myself, Kaitlyn. So let's first start off by talking about our protagonist, Hans. Hans is a youth living in a rural town in New Brunswick, acting as a primary caregiver to his elderly grandmother while he takes a gap year during the COVID-19 pandemic. As a result of stress, isolation, and squash opportunities, he begins experiencing symptoms of anxiety and panic attacks. When he reaches out for help, he feels that his only option is a hospital's emergency room. There, he does not receive the help that he needs, and he doesn't know where to turn next. It's important for us to note that Hans's story is not a chance series of unfortunate events. Many youth share Hans's social location. Nearly 50% of our province lives in rural areas, and 45% of young adults do not attend post-secondary school right after graduation. The intersection of these factors make it difficult for youth like Hans to obtain mental health support that may otherwise be accessible through urban centers or post-secondary institutions. As we approach our second year of a worldwide pandemic, many of us share feelings of chronic stress. Reports of pandemic-related mental health declines indicate that youth aged 18 to 34 are the hardest hit. The consequences of this stress are often exaggerated in populations that do not have the ability or the know-how to access the resources that they need. Hans's story conveys a very important message. New Brunswickers do not know where to go for their mental health needs. In 2018, 39% of New Brunswickers reported that they do not feel that their mental health needs are being adequately met. This statistic should be very concerning to everyone here today. It led us to question why these needs are not being met. Is it because the services do not exist? Or is it because there is a gap in knowledge? Is it possible that people just don't know who to ask, where to go, or even whether the services really do exist? Well, as it turns out, New Brunswick does have a wide variety of services, resources, and support networks, many of which are specifically targeted to the needs of groups like caregivers or youth, or populations such as newcomers or individuals experiencing homelessness. The plethora of options alongside the needs of our province is a paradox, one that we would like to solve. Our team feels strongly that the most essential and effective strategy to help people like Hans is to create an initiative that will address this major gap in knowledge through a targeted social media marketing campaign, which we have titled Mind and Be. Our purpose is to bridge the abundance of resources available to the people that need them. Our hashtag and logo can be found on the screen, both of which intentionally contain features from the My Health NB program, the New Brunswick logo, and one of the leading Canadian mental health research nonprofits, the Brain Canada Foundation. The intervention design for Mind and Be was developed using a research-backed approach based on key psychological and sociological constructs. First, we leveraged the activation model of information exposure by creating a simple but eye-catching logo that can be easily associated with the resources that New Brunswickers already engage with regularly. This is why we use the symbolism from My Health NB, the Government of New Brunswick, and the Brain Canada Foundation. Second, we are appealing to the theories of reasoned behavior and action in social cognitive learning by creating a marketing campaign that we hope to be omnipresent. Mental health stigma is a major barrier for seeking help, but frequent encounters with advertisements can reduce these resistant attitudes. Frequent exposure to a mental wellness campaign can also promote learning in the same way that humans learn through all other social interactions. In other words, our targeted campaign is not only intended to raise awareness, but to promote learning and ultimately drive help-seeking behaviors. Theories of agenda setting, priming, and framing effectively explain the ways that politicians, corporations, and other forms of media manipulators are able to apply TRA/B and SCT to influence the attitudes and behaviors of their audience. Mind NB is based on the same theoretical basis, but instead of promoting a product or political views, we intend to apply these theories to a key issue in mental health. The final and most essential construct that we adhere to in the development of Mind NB is communication inequality. Communication inequality refers to disparities in social groups' access to information. We have already outlined some of the ways in which Hans's social location as a rural youth outside of an educational institution may contribute to his issues. My teammates will walk you through the many ways that our campaign will accommodate to the factors that may contribute to communication inequality, as well as many additional social locations that are abundant in the province of New Brunswick.
So what is our innovation? After researching possible services in New Brunswick that are lacking or in need of improvement, we found a large number of free and accessible options currently offered. But the question remains, why didn't Hans use any of them? Our group determined that Hans struggled to get help not due to a lack of resources, but because he wasn't aware of what resources were available to him. Our group's initiative could be described as a targeted social media campaign designed to increase awareness about existing and accessible mental health services in New Brunswick. Due to our limited budget, we felt that developing an all-encompassing resource and testing it, researching it, marketing it, implementing it just wasn't feasible. And that resource would still have to be more effective than anything offered, available currently. Our short-term goal would be to increase uptake and interaction with these services in the 15 to 25-year-old population. We will do so by collaborating with 65 registered charities in New Brunswick for mental health, particularly focusing on 21 charities whose main premise is to collect and provide funds for funding mental health services. With their help, we plan to create platforms on at least 7 social media platforms, including but not limited to TikTok, Instagram, and Twitter. Our group's goal is to bring awareness to existing resources offered by New Brunswick. A $10,000 budget is extremely limited when creating a resource or even updating existing ones. Creating an awareness initiative is a low-cost and effective way to get people to use existing resources, which will result in more funding from the government in the future. This slide is just a few examples of current resources that are already operational in the province. Resources like Horizon and Vitalite Health Network offer mental health and addiction services through the public health system, while eVisit New Brunswick provides the ability to virtually connect with a social worker or a free master's or PhD, or connect with a social worker for free, or a master's or PhD level therapist for a fee. Other options like Bridge the Gap and Mindwell New Brunswick are accessible through government funding. Bridge the Gap is geared towards adult and youth, and is an accessible online service that connects users with content that can provide advice, support, assurance, and educational material. It also supplies direction to finding additional supports when needed, and Mindwell is provided by Mindwell U and made available to New Brunswick residents through funding from the government. It also offers free and mindfulness training to decrease stress, improve resilience, and create positive changes in people's lives through research-backed mindfulness videos and activities. Another option is Social Supports New Brunswick, and it's focused on mental health issues and a plethora of other issues like abuse and neglect, emergency housing, financial matters, legal issues, and end-of-life planning. The New Brunswick branch of the Canadian Mental Health Association uses workshops, presentations, and other educational tools to help those in need. And finally, CHIMO is the crisis telephone helpline for those in need of immediate help. Some federal or non-government organizations can also be linked to supply more resources and offer traveling New Brunswickers options to get help. Some examples that are not based solely in New Brunswick are shown on this slide. Resources like Kids Help Phone and Canada 211 are telephone-based services that can provide support directly or guide people to other services across the country. Canada 211 can be accessed 24 hours a day in more than 150 languages by phone, chat, text, and on the web. Wellness Together Canada was born out of the COVID-19 pandemic, and its goal is to help people of any age cope with the pandemic, other stressors, grief, natural disasters, and addiction through an online platform. It offers resources like skill building courses, wellness tracking, breathing exercises, and more through trusted service providers like Mindwell. Charlie Wellbeing is another option, and it's a paid text-based service focused on providing youth mental health care based on their schedule and needs. The Mental Health Commission of Canada and the Canadian Mental Health Association and the Youth Mental Health Associations are organizations focused on raising awareness and decreasing the stigma surrounding mental health. These organizations are also involved in research and policy making. While these slides do not offer an exhaustive list, hopefully these slides have made it apparent that Hans did have access to tools to help him with his mental health. And despite doctor and nurse shortages, there are still plenty of resources that could supply Hans with skill-building content to better combat the stressors that come with being a caretaker, a employee, a student, and all while living during a pandemic.
Now let's take a look at some data that gives us some idea about some of the current situations in our province, New Brunswick. The graph in front of you here shows New Brunswick young adults' mental health self-reports who are ranged from 18 to 24 years old, according to MHRC. Here, red bars depict high level of depression and anxiety level. The data from this graph depicts that before pandemic, 30% of the young adults reported about high level of anxiety. Since coronavirus, which rose up to 39%. Moreover, on the right side of the graph, you can see that high level of depression followed the same trend, rising from 5% to a spectacular 28%. Next slide, please. Now, if we move our focus to the caregivers working in our society, Hans is not the only caregiver feeling the stress. New Brunswick has 62 nursing homes serving about 4,000 residents. It is estimated that 3 times that number are cared for at home by caregivers. In Canada, in 2018, 7.8 million Canadians aged 15 and older, which is 20% of the population, were caregivers. While caregiving can be time-consuming, it can also be a positive experience for many family caregivers, providing a sense of giving back to a loved one and an increased sense of competence and purpose of life. Among caregivers who are 15 and above, 55% of them described their caregiving experiences in the last year as rewarding. Despite many rewards of being a caregiver, caregiving often has an impact on a person's physical and mental health. When asked about stress, about 1/3 of the caregivers responded that their caregiving responsibilities were stressful or very stressful. It is also important to note that becoming a caregiver is not always a choice. In case of senior caregivers, more than 63% reported that they had no choice but to take on their caregiving responsibilities. If we think about a service that can confront this issue, 811 is a primary point of contact in New Brunswick for all of the social services that are offered. By remembering those 3 numbers, 811, you can have access to information about everything New Brunswick has to offer and a caring voice to lead you through. This is exactly what Hans needed. In Hans' case, Hans still lives with his parents because he may not be able to afford the rent. This leads us to a crucial topic of New Brunswick, homelessness. In New Brunswick, according to the census data, in 2016, there were 200 people who were homeless. In 2018, the number rose up to 315 people. Among these 315 people, 22% of them were youth aged from 16 to 24, 49% were aged from 25 to 49, along with 23% of them were indigenous. This data is normally collected every 2 years in February. The data from 2020 is still not available due to COVID. 58% of the homeless population surveyed that they need the mental health help. Multiple organizations that work with the homeless here in New Brunswick and nationally will help them access the links to the mental health help that is provided. In the news right now, there's a lot of talk about the housing crisis and the rent price increasing that are catalyzing more people into homelessness. Next slide, please. Coming back to Hans, his family came from Germany when he was 3, although he grew up with English as his first language. Like Hans, many New Brunswickers use different languages. A language barrier is a form of communication inequality. A person can't get care if they cannot understand what is being offered to them. 32% of the population in New Brunswick have French as their first language. As of the 2016 census, there are 8,870 Mi'kmaq and 350 Wolastoqey speakers. The Mi'kmaq and Wolastoqey languages are part of the Algonquian language family. After English, French, and Mi'kmaq, German is the mother tongue of most New Brunswickers, followed by Korean, Arabic, Spanish, and Chinese. The Need to Talk is a national helpline that offers help in other languages, including Ojibwe and Cree as well. Our intervention will help increase the languages to include Mi'kmaq and German as well. Now, Andy will talk about the financial plan and long-term goals.
My teammates have explained to you how My New Brunswick is a bridge. Our gap analysis showed us what was missing for New Brunswick individuals And the bridge is actually what was missing, the way to access the services. The key to this is connection. One of the ways that we intend to propagate all of the services that are currently available is through a charitable organization status for us. So our first $600 will register My New Brunswick as a charity. $300 more for a name search, and we'll sign up for a tax ID number. That will allow us to use $3,000 for our initial outreach campaign. And this is going to be outreach to our first influencers. That's our short-term goals, and that will be met. We're going to use analytics to track our hashtag use, of course, to make sure that we're doing what we believe we wanted to do. And then with our remaining funds, we're going to move into a phase of financial propagation. We're going to write proposals to work with other charitable organizations. Bloomberg and StatsCan tell us that there are 2,020 Canadian charitable organizations that deal with mental health services. In New Brunswick, there are 65 registered charities. 21 of those are specifically created to create partnerships with others just such as us in My New Brunswick. We're going to use those people for both uploading and downloading of information, finances, and connection. One example of that in New Brunswick is the Medavie Health Foundation. Their assets in 2020 were $66.8 million, and they had an income of $9.2 million in 2019. $11.6 million in 2020. Their mission includes forming partnerships and funding programs focused on adolescent mental health, healthy living, and post-traumatic stress. We are exactly the kind of client that they wish to fund. Another example of a good funder from New Brunswick here is the St. John Hospital Foundation. They have $27.9 million in assets right now, 14 people on staff, and they bring in $12.6 million annually. That foundation raises funds to support the St. John Regional Hospital, as you're aware, but they also support mental health projects in research, education, and community services in New Brunswick. And that is exactly what we're doing. So we will build upon their funding and their connection to move into our next phase. If you look at the up and down arrows in this slide, it shows the type of relationship we're building. We want connection that will provide mentorship, finances, and partnership as well. So these are professional and financial linkages where we will both give and receive funding. There are 296 schools that we can work with in New Brunswick, 16 Atlantic Canada universities, 8 in New Brunswick, 5 colleges in New Brunswick, and 22 in the Atlantic provinces. Then we're going to build on municipalities. We have 236 LSDs, all of whom have money for community services such as ours. Municipalities, cities, towns, and villages, we have plenty of those in New Brunswick as well. We have 32 band councils for our Indigenous people in the Atlantic provinces, 16 of those in New Brunswick. And we can leverage the funding from those organizations to help continue to fund our organization, which will continue to provide the linkage. So that's our short-term goal, but why do we even need to exist in a few years? Connection is the key, but in the long term, we need to influence public policy. The place where we socially find ourselves in the world supports or harms our mental health. So our gap analysis located for us that we need to work on public policy about social spending. If you listen to the agenda setting and what's going on in the media today, you'll find that we have a housing crisis that Tamim mentioned. We have an aging population, so we require caregivers, and we have a mental health crisis. We're dealing with mental health calls using our police. All of this priming in the media indicates needs for our service, but our research followed it up. New changes to healthcare that came out just that week invite people to use New Brunswick 811, and they make eVisit New Brunswick's free for all users. These are wonderful steps forward, but we also received information about police responses to mental health calls. In one city, St. John alone, they had 1,758 mental health calls last year, and that's an increase of 32% over 5 years and 152% over 10 years. Social spending in our country, which is measured by federal program spending as a percentage of GDP, it's increased from after the Second World War up until 1970, and then it started to fall back down again. We're now close to 1950s levels. Government policies have increased income and wealth inequalities, created crises in housing and food insecurity, and increased the precariousness of employment. This Raphael quote from his 2014 study points out the inequalities in our society that we need to work with. Poor people know they're poor, and there's shame and stigma associated with that, and that leads to social exclusion. That's the exact opposite of the connection that we need Hans and everyone like him to feel. While we know that mental health issues affect people regardless of their financial status or even their social location, we need to support the equitable distribution of resources by writing policy that supports mental health. Because you can't yoga your way out of systemic racism, and you can't go for a walk and suddenly affordable housing is available to you, and you can't plan your day better to somehow afford healthy food. So our long-term goals include helping to change Canada's social spending. When we look at Hans, the major component of what Hans needed was connection. And that is what Mind New Brunswick provides. The connection between all the existing things that exist for our use and what he needs individually. Our references follow. And then we'd love to take questions from our audience.
Well done, guys.
Thanks.
Would you like me to continue sharing or to close so we can see each other a little more?
Up to you.
Hi, can you hear me?
Yep.
Yes.
Hi, I'm Dr. Andrew Bombach. I'm one of the judges. That was a wonderful presentation. Thanks so much. Very comprehensive. So one thing that I'm wondering about is, do you know anything about things like the waiting lists or how available the individual services are that you would be bridging people like Hans to?
I can speak a little bit on that. Things like eVisit New Brunswick, it's like an online platform to connect you with a counselor or social worker. That would kind of had a wait list, but things like the Wellness Together Canada and stuff like that, you just make an account and you kind of do it on your own time. But they're obviously not like a medical-based model, right? It's more of your mindfulness, how to cope with stress, kind of, more of like an advice system. Same with the one social supports New Brunswick, right? Like you're not going to get medical treatment, but it still might help someone like Hans overcome the stress, going into a university, stuff like that. If you're wanting to look and get medical-based treatment, there's still the wait list, but these services are kind of your first contact, maybe, or where to find services, stuff like that, I guess. I see another question.
Just to add to what Kyle's saying there, one of the things that has been happening in our province is that we're moving to Kids Help Phone has been around since the 1970s, and they are right now providing both phone and text-based instant support. eVisit New Brunswick is offering 24 to 48 hours of wait time only, but it's for a discussion with a social worker rather than a psychiatrist of any kind. There's still going to be biomedical waiting lines, but connection to support such as like the caregiver support for Hans may be a gap bridger. It may bridge the gap to getting that long-term care that we're all still waiting for.
And we also mentioned about the 811 service as well. So, yep.
Right.
Jennifer, I can see your hand up.
Hi, yeah. I'm Jen. I'm one of the judges as well. And I did have I don't know how to put my hand down now. Oh, there we go. I did have a question related to the connecting and the kind of the navigating through the services. You listed a lot of services for mental health, housing, that sort of thing. Do you expect that there are going to be some sort of, I don't know, a flow chart or a navigation tool or a human resources to help direct somebody to the right resource, because they could spend a lot of time running in circles at this point?
Yeah, I think a flow chart would definitely, I think that it is a great idea, but also I think we would like to kind of amalgamate our resources and ideally have them available through My Health NB, because that's already something that all New Brunswickers are, especially in these COVID times, actively using. And I think the province is transitioning towards more use of that My Health NB. And so to have a section for our Mind NB with all the resources with the flow chart to kind of help people navigate, even kind of, a flow chart, and there's other charts that are like yes, no, yes, no. I think something like that would be great to direct people to where they need to go and who to call.
And even currently, some of the services like Bridge the Gap, one of their goals is to direct people to the proper resources and to the services that they might need, because not everyone knows what services they need or what are out there. So even Canada 211, you can call and just get information, even when you're out of province. So it's kind of like Kaitlyn said, we're kind of raising awareness to what we have now, and then future kind of put everything together, right?
But and like Tamim told us, 811 also offers a kind, gentle voice that will tell you about all the things that are available. And I think that that's missing, that connection point with the human being. And so if text doesn't work for you, the phone call might be the way to go. It gives you a little more option for some humanity in the process. But I love the flowchart myself.
Those are great answers. And I guess my only other question would be, we know that Hans, a lot of his mental health concerns right at this point probably stem from his isolation during the pandemic. And I don't know, I hope I didn't miss this, because forgive me if I did, but did you address maybe some of those barriers to reconnecting with peers during this as well, to kind of prevent those mental health issues from happening in this population?
Again, a lot of these services are based around mindfulness, connecting with others, how to cope with situations. Because even me personally, once you're isolated and kind of getting back out, you're stressed about, having to go back in isolation again. So I feel like the resources that are kind of based around that preventative maintenance, I guess, could be helpful in Hans's case. But again, that isolation sense is a really individual and kind of a subjective part of all this, right? Not everyone has to isolate. Not everyone can work from home. Not everyone's in school. Some people live with their friends and roommates. So it's kind of one of those things that, it's kind of down to an individual basis as well. But a lot of these services are based on your own schedule, contacting with others. Like Andy said, the humanitarian or the human side of it's still there. Kids Help Phone. So there are still ways to connect. The actual getting outside part, we have very little control over, I guess, in terms of like mandates and stuff like that. So
yeah, so maybe less so helping people get out there, because that isn't always possible if we're in red phase level 3 like we are right now. Can't necessarily help them get their friends over, but we can help them cope with the isolation that you feel when your circumstances are unpreventable.
I also think, I'm sorry.
Sorry.
Go ahead.
Sorry, I didn't put my hand up. You go ahead. No, it's good.
I was just going to say, I also sort of wondered a little bit about Hans's family situation, where it seemed like a lot of responsibility was potentially being placed on him. And I love that your group incorporated that idea of caregiver burden, and how much he was sort of being asked to do. And I think one thing to think about in your long-term goals too is the idea of, this is an aging population, as you recognized, and so we're going to have to be thinking about those supports, including for end of life care when perhaps that family situation is not going to be adequate. And now I'll open the floor up to Victoria.
Yeah, I think Tamim could have done a whole 20-minute presentation on caregivers.
Right?
Yeah. Good morning. It was a great presentation entirely. It was really good. I think you hit a lot of points, like of where you want to start, you know, a starting point for someone. Like not everybody's going to be able to reach out, have someone to talk to, maybe, you know, go over their problems, and that would work for them, right? Whereas someone else, like you said, you may have to veer more to the medical aspect of it, like going to the hospital, trying to get referred to someone. But where you're coming from, it's a great place to start. And I did like that as well. Like a lot of the other judges had asked the questions that I was going to ask. So it was a great presentation. You guys touched on a lot of points that it's out there, and it's good that there was even things that, I mean, I work in healthcare, and there was some of these agencies I didn't even know of. So it's nice to know that there's other things out there for people to try, because like you said, one thing may not work for some, but another would work for another. Because some people want to just text, they don't want to talk in person, or they want to hear that voice, or see the face. Like, you know, if they want to do FaceTime, you know, with someone, and that way get some close feeling like, you know, they have someone to actually talk to. So I really appreciate your presentation. It's great.
Thank you.